Good morning, everyone. I want to welcome everyone here to our Medicare webinar. I think we have over 1,000 people signed up, so I want to thank everyone for taking a little bit of time out of their busy schedule to learn a little bit about Medicare. We have a very special guest today when it comes to Medicare. We have Dr. Katy. Dr. Katy is like the advisor when it comes to Medicare. She travels the country teaching the ins and outs, the ABCs of Medicare, and I want to thank Dr. Katy for joining us. Dr. Katy, welcome to this webinar, and I really appreciate your time. I know you're extremely busy, but I think this is an extremely important topic, and I think a lot of people, like you say, are overpaying for Medicare, and there's just so much to this that thank you for taking the time to kind of educate our clients.
You're welcome, Joe.
Here's the agenda. We're going to look at the impact of Medicare on retirement planning. She's going to get into strategies to avoid lifelong Medicare penalties. Then we'll look at how to minimize the cost of Medicare and really how to maximize Medicare coverage. And then we'll get into a retirement planning checklist. So, and if we have time, we'll take questions and answers. Everyone's phone is muted right now, besides Dr. Katy and I. But if you do have questions, you can always email us at info@purefinancial.com, and we'll make sure that we get to those questions. So without further ado, I'm going to pass the mic and everything over to Dr. Katy. And I believe, let me just give you the mouse. And Dr. Katy, you have the floor, my friend.
All right. Thanks so much, Joe. And thank you for having me to speak with your listeners today. And thank you, everyone, for taking some time out of what is no doubt very busy time of year for you. And, well, of course, who is affected by Medicare? Well, it might be you. It might be somebody that you're taking care of. You might be a caregiver, an adult child for your parents or an elder relative, or it could be parents, siblings. There are a lot of people that I've assisted who are assisting siblings. Small businesses are affected. More and more people are working beyond 65, and there are special implications about how Medicare may or may not work together with those types of coverages, and we're going to talk about that. And employer-covered retirees. It used to be fairly standard that people expected to get coverage in retirement. That is less and less the case. I'm speaking to you today from Rochester, New York, and one of our companies that's very famous here is Kodak. And if you follow the story of the last couple of years, Kodak is a very different company now than it once was. And folks who had coverage no longer do. And now they have to take care of for themselves. And one thing you could do for yourself or for others is to plan ahead to be able to cover these costs yourself, because that's the reality for people. So, in fact, it really affects Medicare, affects everyone. This is a startling statistic that 90 to 95% of people overspend on Medicare. And it's been found in several studies that big institutions like Harvard, MIT, the most recent one was at University of Pittsburgh. And how is it that people overspend when you're already thinking, and if you've had anyone in Medicare that you've helped or yourself, that, boy, if I could do better, why is it that I'm not? The biggest reason that people are overspending on Medicare and not getting the biggest bang for their buck is that they don't understand how Medicare works, which you're going to have more of understanding after this. They don't know how to pick their plans to suit their needs, because Medicare is much more individual than you might think, and it varies quite a bit around the country. And we're going to talk about how you can maximize Medicare and then minimize wasting money, because it's a shame to waste the money and not get any more value or any more health care for it. It's really critical you're interested, you're in on the webinar that Joe is hosting today, to plan for health care and retirement. Healthcare costs will not be optional in retirement. They will be mandatory. And if you do not plan for them, you're going to have a very bitter pill to swallow when you get there. Because since they will be mandatory, you will have to pay them before you would take care of other things you would like to. Most people want to think about taking that nice trip, spending more time with grandkids, maybe moving to a part of the country where you think you could do some activities you haven't been able to do. It's critical that you plan for your health care and retirement so that you are able to do all of those things. And there are some key things that we're going to talk about. One of the biggest ones is to understand Medicare enrollment periods. And if you do understand when and how to get into Medicare and when you don't need to, it will really help you avoid lifelong cost increases and expensive coverage gaps, because Medicare has a lot of rules. And if you don't get in at certain times and aren't allowed to wait and delay to another time, you will find out that you won't be able to get in when you want to. You will have an expensive lag until you can get coverage. And on top of it all, you will pay penalties in form of extra premiums for the rest of your life. And if you understand the rules, you don't need to do that. So you can make your money go much farther. The other thing is, when people are in that spot, and I see more and more folks who are, I think mainly because people are working beyond 65 and understandably being confused about the rules, it's very stressful for them. And then it's very expensive. And when you plan ahead, you don't need to face that. Another key thing we're going to talk about is how to shop smart for Medicare. That's what we call it at Good Care, how to shop smart. You really want to make sure that the health care services that you or your family will need are covered by your plan. If they are not, you're going to be paying premiums but not getting value. And prescription drugs are a big influencer of this, because plans vary quite a bit in terms of what prescriptions they cover, as well as what the costs will be for those specific medications. And if you do your homework up front, your plan will work best as possible, and you won't get a terrible surprise when you get to the prescription counter to pick up your medications. Because one thing we see consistently, which adds into why people overspend, and 90 to 95% of people don't get the best value for their Medicare, is that they look for the lowest premium, which is understandable. But if you stop short and then don't look to see, are my doctors in this plan? Are my medications covered as best as possible? Then you get those unwelcome surprises, and it's too late, at least during any given year, to make those changes. Let's start with a brief overview of Medicare, because Medicare has many parts and pieces, and we call it the alphabet soup of Medicare, because we do use a lot of initials in Medicare. There's Medicare Part A, which is hospital coverage. It covers hospitalization as well as brief home care after a hospitalization or rehabilitation stay in a nursing home. Now, there are very specific criteria people need to meet from a medical necessity standpoint to get those coverages. And then there's Medicare Part B. It's also called, actually in the rules and regulations, supplemental insurance. Medicare Part B actually covers everything outpatient for you. It covers seeing a doctor, having a laboratory test, going to have outpatient surgery, and all types of things. It's a very big benefit. Those two together are what you may hear people call original Medicare, Part A and Part B. Now, since Part B, in some places, is referred to as supplemental insurance, I want to make a little mention of that word supplemental. Many people talk about, I need a supplemental coverage in Medicare, and that term is highly confusing because supplemental could mean Medicare B. It could mean two other types of insurance, which we're going to talk about in our presentation here. I tend to use the terms that are very specific to the types of coverage. So we talked about Medicare Part A and Medicare Part B. Now, Medicare Part A, for most of us, we don't pay a premium for. We've paid through our Medicare taxes, whether ourselves or a spouse. Medicare Part B, as an outpatient benefit, we actually have not paid in advance for. And many people are surprised when they get to Medicare that they have to pay any premium at all. When Medicare was founded 50 years ago, the premium was $5 a month. It was negligible. Most people didn't even know it was coming out of their Social Security check. Now, it's $121.80 a month minimum per person, and upwards from there based on income. We'll discuss that as well. But it's something you need to plan for because you will have to pay for those costs. Okay, so Medicare A and B, they cover quite a bit. They cover 80% of your costs. But 20% you need to pay. So how are you going to pay for that? We're going to talk about that in a minute. So I'm going to skip over Part C. Even though in the alphabet we go A, B, C, I'm going to move on to D first, because that Part D, as in prescription drug, is the third main part of Medicare. As you'll find in a minute, Part C really isn't separate. It rolls some pieces of Medicare together. That's why we need to talk about Part D first. Medicare Part D covers prescription drugs, most prescription medications. Not all. Not every class of medication is approved. There are a few that are not. Most of those that are not particularly expensive, but some are more costly than you would think. One that's surprising to people, that many people do take medication for ED. A common one is Viagra. Viagra is not covered, and you might be surprised about that. And it's $200 a month, generally speaking. So those are the kinds of things it's helpful to know ahead of time that Medicare doesn't cover everything. It covers most. And Medicare prescription drug coverage, you could get it separately through private insurance. It's regulated by the government, but it's all offered through private insurance. Or you might put all of your parts of Medicare, Part A and B and D, together in something called a Medicare Part C plan. They're also known as Medicare Advantage plans. And they're marketed around the country by private insurance companies, again, regulated by the government, but they're private insurance. And they're styled and designed like an HMO would be, or a PPO, Preferred Provider Organization, or a fee-for-service plan. And that's one way to put your Medicare together. And for many people, that may work. There are some pitfalls in that we will talk about in a few minutes. But the key thing to know is that Medicare Advantage, while it sounds great that it may be advantageous, it may not be. Because if your doctors and hospitals and other providers are not what I would say in the network, they're not covered by your plan is not going to buy you much. And then you will have gotten a plan, and you're going to think you're covered, and you pay for premium, and then you go to use it, and then you're stuck with some big bills. And again, you can avoid that up front by doing the homework. Same with prescription drug coverage. As I mentioned, the plans cover things quite variably. Even those medications that are covered differently by different plans, meaning that if one could be covered in a cheaper Tier 1 structure, if you're used to generic medications, Tier 1, 2, 3, and 4, and sometimes there are 5 now, the lower the tier, the cheaper the cost. The very same medication could be a Tier 1, cheaper medication in one plan, or a Tier 3, costing much more in another plan. That's why you want to look ahead. Now, for some people, as I mentioned, that Medicare Advantage plan may work if your care providers are all in the network, but sometimes they're not. In that case, a MEDIGAP plan, which is another style of supplemental coverage, may fill in the gaps in Medicare Part A and B for you, because A and B generally pay 80% and you have to pay the 20%. And MEDIGAP, that's a whole thing of itself. There are 11 styles of MEDIGAP. We're not going to go over all of them today, but there is one, and I'm going to throw out another initial here, and it's called MEDIGAP Plan F. F is in full. MEDIGAP Plan F covers the most co-payments and co-insurance in Medicare that you, the beneficiary, or your family member would have to pay for Medicare A and B. And for many people, that may be a better solution than an Advantage plan and actually more cost-effective. The premiums are higher on a monthly basis, but the coverage is more extensive. So that's MEDIGAP may fill in the gaps better than an Advantage plan. And you can already see that there's some homework and organization to do ahead of time so that you're not those folks that are overspending on Medicare. And in this case, if you've got a MEDIGAP plan with a Medicare A and B, you would need prescription drug coverage separately, and that is available. Now, we're going to move on to discuss Medicare premiums that are based on income. I mentioned Medicare B. The premium beyond the initial base rate of $121.80 a month is based on person's income. And if you're in a higher income bracket, which is $170,000 for a couple married, filing jointly, or $85,000 for a single individual, you're going to pay an additional surcharge for Medicare Part D for prescription drug coverage as well. So it's important to know, how does this number get calculated, and how can you work with your advisor to make sure that when possible, from a financial planning standpoint, we're going to talk about that a little, and I know that Joe has thoughts about this as well. There are things you could do to consider in your retirement plan that would still give you sources of cash in retirement, but would not go into this calculation. And that'll be something that we mentioned briefly. And then you can have a more in-depth conversation with someone like Joe and his folks. But basically, the Medicare premiums are affected by something that's called the Modified Adjusted Gross Income. We should have spelled that out for you there, the MAGI. It's not the gift of the Magi. It is the Modified Adjusted Gross Income. And those Medicare B and D premium surcharges are based on that number. And anything above those thresholds, I told you, and we'll have a chart in a minute, you're going to pay extra. It's called an income-related monthly adjustment amount, and you'll see those initials there. People will throw out the term the IRMAA, and there aren't many ladies around these days called IRMAA, but back in the day there were a good number, and I think they wouldn't be very happy to have their name co-opted that way. And it's the Social Security Administration that determines your IRMAA bracket, and show you the formula in a minute. You say, well, why is that? Social Security actually grants you your Medicare card. It's your participation in payment in taxes. And Social Security that's who you apply for your Medicare card, your A and B. And they will determine by looking at your tax return from 2 years in arrears. So if you are going to Medicare even 2 years from now, this year's tax return will be the base year for those premiums. And I'll show you a little schematic here that how does Social Security calculate anyone's Medicare surcharge? First, they look at your 1040 tax return from 2 years ago. They're always looking every year. They calculate your Medicare Modified Adjusted Gross Income. Then they determine what bracket. You'll see there are 5 brackets that people could be in based on income. And then from there, if you're above the base, you're going to pay more in those premiums and surcharges. So here's the formula here. You can see. You can go right to your 1040 and look at line 37 and line 8B, or take it to your tax preparer. And you add those two numbers together. So it sounds complicated. We've got a lot of initials here, and we're throwing around a lot of terms, but it's 2 numbers on your tax return. Line 37, which is your adjusted gross income, and tax-exempt interest. Line 8B, you add the 2 together, and you will come up with the Medicare Modified Adjusted Gross Income. Now make sure you use this calculation. There are other MAGI calculations that are used in retirement planning that are not the same as this Medicare one. So it's key to use the one that is right here on our slide. Okay, so where are these brackets then? You want to determine your Medicare bracket, particularly for planning in the future when you say, where's my income going to be? Again, so you're not shocked on any premiums you're going to have to pay in surcharges. These are the brackets that are in force now, as well as they're going to change in 2018. That law was passed. So I'm showing you both sets of brackets. They're both 5 tiers, but you'll see in 2018 the upper tiers, people tiptoe into those much more quickly than they are now. So for example, if you're a single individual and next year you're going to look at your premium in 2017, it's going to be based on your 2015 tax return. And you can see tier 1 for a single individual starts at less than or equal to $85,000, and then it goes up to $107,000, $160,000, $213,000, and then above for the top tier. Now, in contrast, in 2018 and going forward, again, they're always looking back 2 years, so they're going to look at your tax return in 2016, but those upper 3 tiers will start at a lower income number. That's why I'm glad you're listening in today, so that you can be planning ahead for your financial planning and your taxes this year because it's this year's tax return that will determine what those premiums will be in 2018. And once you get there, if there were any modifications you could have made, it will be too late. So now is the time to think about it. And then you can also see in our chart here where married folks filing jointly would fall, again, below $170,000, and that doesn't change in 2018. And honestly, most people are at that level. But for those who have worked hard and been able to save, been fortunate enough to save a lot of money, and that's a wonderful thing, if you're going to be above that, particularly into that third tier, it's something to be aware of, and I'll show you then what the premiums mean for your budget. But you can see from the third tier and above, this year and next year, the third tier begins at $320,000 and actually $1, and in 2018, it's going to be significantly less, $267,001. You're going to be into those tiers. Actually, I'm misspeaking there. I'm misspeaking. There is the third tier, but it starts at $214,001. So if you're $1 over into the next tier, you're already into tier 3. And then if you're $1 over that 320, you're into tier 4, and so on. But the threshold numbers change quite a bit in 2018, again, based on the 2016 tax return. And going forward, the 2019 premiums will be based on the 2017 tax return, and so on. Now, what does this mean in terms of real dollars for you? There's Medicare premiums, which is the base premium that everyone pays unless you're very poor. And do know there is assistance for people who are poor. I mean, some people really are, and you might be a caregiver for someone who is. And that's something that's important to look into through perhaps your regional office on aging. We're not going to go into the details of how that works, but there is assistance available, because often people say to me, well, how can anybody pay this? Well, those who are poor, there is relief for. But for the rest of us, this is what we're going to be paying. And these are premiums for this year, 2016, again based 2 years ago on the 2014 tax return. So if I'm in the first tier, I don't have any extra IRMAA. I don't have extra income-related monthly adjustment amounts, but I do have a base premium of $1,462. That's per person. And for a couple, that's about that's a little over $2,900 a year that you pay just for your B premiums. That becomes significant. And for most people, that's an after-tax dollar, so that's something to consider. We put an average Medicare Part D plan premium number in so people would know what that would be. And then you could see what the premiums and surcharges are for the individual and the couple there. And we put the two together. You see the individual's a little over it's almost $1,900, and the couple is a little over $3,700. But as you go up in income, again, $1 into the next bracket, people will pay Medicare Part B and D income-related monthly adjustment amounts. That's our second column there, ranging anywhere from $650 to $3,600 per person annually. That base premium remains the same, as does the Part D premium, but you can see that the premiums in total with surcharges can escalate pretty rapidly, up to over $5,500 for an individual, or nearly $2,000. $12,000 for a couple. And again, those are typically after-tax dollars. Please consult with your tax preparer, because there are some tax implications, particularly for people who are still working in small business, and portions of that may be tax deductible for you. And I'm not your tax expert. I just know how it generally falls from many, many people.
Hey, Dr. Katy, I got a quick question for you.
Yeah.
So let's say that someone has high income for maybe 1 year. So 2016, they have very high income while they're taking Medicare premium. So that jumps, let's say, their Medicare premium to the tier 5. So they're paying, the $5,000 or $12,000 a year for a couple. Mm-hmm. But then the next year, they're probably a tier 2 or tier 3 type income earner, are they still going to have to pay that high premium, or do they go back, or does Medicare look at those numbers every couple of years, or how does that work?
Yeah, well, great question, Joel, and we're going to talk about in the presentation shortly how people can apply for, when it's appropriate, something called reconsideration, because income does change over the course of retirement. And there are certain criteria when people can tell Social Security that say, okay, 2 years ago I had that money. Now, for example, a typical one is I've retired and I don't have the income I once had. And so if the 2016, let's say the 2014 tax return was high, and then now I'm below a next tier down. There are 5 reasons, we have them later in our slide, where people can notify Social Security with a process and say, hey, I don't have that income I once had. And if you meet one of these 5 criteria, to be honest with you, I've not had a person who responded to their notice in time who wasn't granted a reduction. And
right.
Okay, so we'll go into those
we can definitely cover that later. That's great.
Yep. Yeah, it's really important. I'm glad you brought it up, because it's one of those things where I say don't leave money on Medicare's table, because if you don't tell them, they won't know. Okay, so, you're probably feeling like a lot of people, like, what am I supposed to do now? Because I've said so many things. I'm glad, Joe, you answered that question. And so you could feel like this poor person who's banging their head. Well, we're going to give you some solutions here of what you can do. First of all is, how are you going to minimize your modified adjusted gross income when possible and appropriate with your advisor? I'm not your financial advisor, but here's some tips you can consider and talk with your advisor about to maximize other of the ideas, to maximize cash flow from other sources that don't go into that modified adjusted gross income calculation, that don't contribute to adjusted gross income or tax-exempt interest. One of the simplest ones that's around these days is a house savings account. House savings accounts are more and more common, and they are the most tax-preferred savings account we have in the United States today. Money goes in. When you qualify, you have to have something called a high deductible health plan in order to qualify to open one. But if you do, you can open an account. Money goes in tax-free. It grows tax-free. And it comes out tax-free when used for medical expenses. It's the only retirement account that, when done properly, it is never taxed at all. And many people are, when they're in the position now to do this financially, are leaving money in their health savings account when they can, and not even using that account to pay, say, a co-payment in their routine health care, because in the long run, particularly the younger you are, the longer that money can grow, that money is going to be better off staying in that account, and then you use your own money, here and there to pick up your prescriptions and so on, if you're financially able to do that. But the health savings account is a real bonus. One thing that's important for people to talk with you about, Joe and others, is that Roth IRAs will not count. So once you've paid that tax and done the conversion, that money comes out and it does not go into the modified adjusted gross income calculation. Now, you really want to work with your advisor to structure that. So as Joe mentioned earlier, if you have a big conversion in 1 year, you're going to pay tax on it, as well as if you're already into Medicare, you're going to pay higher premiums in 1 year, and actually a Roth conversion is not one of the reasons that allows you to escape those higher premiums. But for a lot of people, they're either doing Roth conversions sooner than that, or some people, their newer accounts are Roths, straight Roths, without even a conversion. Reverse mortgages. There are new rules and regulations about them, and there are more protections than ever for the consumer. But reverse mortgage proceeds are not part of your modified adjusted gross income, because you're, in a sense, borrowing from your house. You are not having new cash coming in. So a reverse mortgage could produce cash for you that might keep you. I see them sometimes actually used in conjunction with Roth conversions, so that people could stay away from maybe the next tier up by using a modest portion of the reverse mortgage to help out. But it's kind of a complicated discussion beyond our capability today, but it is worth thinking about. And some life insurance and annuity products also have proceeds that do not go into the adjusted gross income, and any cash that goes outside of that calculation won't bring you up into another tier, and so therefore it's worth considering. Now we're going to talk about Medicare enrollment. Timing is really everything. One of the biggest mistakes I see people make, and then they have coverage gaps and expensive, sometimes lifelong penalties, is they don't know when they're supposed to get into Medicare and when they don't have to, because sometimes if you get into Medicare when you don't need to, you're overpaying and you don't want to do that. But you also don't want to neglect the time to get in and then wish you had and have penalties. This is a chart of the most common, what I'm going to call Medicare enrollment periods. There are many of them. And within this is a very simplified chart here. The first one is the initial enrollment period. And we'll talk about that in a little bit of detail. The special enrollment period, there are probably about 40 different types of those, to be honest with you. There's the general enrollment period, the annual enrollment period, which we'll talk about. That's key for everyone once you're in Medicare in terms of shopping smart. And there are other enrollment periods as well. But we'll start with the initial enrollment period. When is that? Well, for everybody, it starts 3 months before you're 65, and it ends 3 months after you're 65. It's the 65th birth month. It's not your birthday. Some people think I'm going to get Medicare on my birthday. No, you get it on your birth month. And a little tidbit, if you are born on the first of the month, you actually get your Medicare a month early, but you still have that 7-month window. And it's really important during that time frame to figure out what you're going to do. My recommendation is don't wait till you're approaching your 65th birthday to think about it. I really recommend that at 64, I say read the meter on Medicare. Where will you be? What do you need for coverage? Will you still be in the workforce? And if you are, will your coverage substitute for Medicare? And if it won't, what pieces of Medicare might I need? Because many people are working beyond 65, as well as full retirement age is 66, but Medicare still starts at 65. And if you need to get in, you should. And you may get into only some pieces and not others. And then down the road, for example, if you don't need to get in, what would be an exception? Exception would be if you're 65 and your coverage comes from an employer group that's considered large, which is it's 20 employees or larger, whether it's yourself or your spouse. And the coverage is what's called Medicare creditable for prescription drug coverage. You don't need to get into Medicare. You could delay and you're eligible for something called a special enrollment period down the road. But if you're not eligible, if you think, well, I have coverage, but if your coverage doesn't meet certain standards, it won't work. Or if you're in a small business, and many people are, 19 or fewer, by law, Medicare must be primary at that point when you're 65. And you actually won't pay penalties when you go to get in down the road, but your Medicare will be primary, and if you don't have it, that means your employer coverage through a small business, which you may be paying a lot for already, is only paying 20% of your coverage, and that's pretty expensive. So you want to make sure if you should be in, and for some people too, maybe their coverage, even if they are employed, doesn't cover their needs. And Medicare, for some people, actually is better coverage. So you just have to think about all these variables. Now, we're going to talk a little later about the annual open enrollment period that happens every fall. That's really important for people. Everybody in Medicare, it's the time to shop for drug coverage and prescription drug. And if you're in a Medicare Advantage plan, that's a key time to see, is there a better plan for me? And all plans change annually and costs change, and you miss your window of opportunity to do that shopping if you don't take advantage of it. So I'm glad you're listening now, because the fall will be here before we know it. And then there are other enrollment periods as well to be aware of. And just as I say, read the meter when you're 64, because if you wait till it's 3 months before you're 65, I find it stressful for people. 3 months, the clock ticks off very quickly. And, think about it at least when you're 64, and that way you'll have time to say, oh, if I'm employed, I better check out my coverage. Or, all these types of details, because there are some, of course, important details to consider here. So, yes, timing is everything with Medicare, because if you don't, do your timing properly, and Get in on time, which this is telling you here. You can start 3 months ahead of your 65th birth month to apply. If you are already getting Social Security retirement benefits, you'll already be enrolled. One of the problems is many people are delaying. They're working or would like to get a higher Social Security benefit, which is great, but you must trigger a Medicare enrollment yourself if you need to have one. And if you don't, those are the folks that wind up in penalty because they say, hey, I didn't really even know. And unfortunately, there's no requirement that you're notified by Medicare. People talk at the national level to put out a standard notice. There isn't one yet. So it's just important for you to know, do I have to apply or not? If you do have to apply, it's pretty easy. You can do it online now for most people, or you can do it on the phone or in person at a Social Security office. And you have to decide what parts you need. That's actually the topic for a whole nother day. Some people may only need one part of Medicare, Part A, because they're going to say, well, I'll get into Part A, I don't have to pay for it, and I still have employer coverage. Sometimes that's smart, sometimes it's not, particularly with these new high-deductible health plans. If you have any part of Medicare, you can't contribute new money into your health savings account, so please be careful about getting into Part A. It used to be standard advice that if you had employer coverage, you'd say, well, I'll get into Part A only, I don't pay a premium. That might not be the best advice now. But then go on from there to decide, do I need A and B and a drug plan? Do I need a Medicare Advantage plan, a C plan, or a MEDIGAP? Or do I have retiree coverage, but I still need A and B? I haven't seen a retiree plan in a long time that didn't at least require A, and most require Part B as well. And if you don't apply during your initial enrollment period, make sure you're eligible for a special enrollment period later. If you don't, you're going to have to wait. You could wait up to 15 months for new coverage. If you found out now that you should have applied a few months ago, you can't apply for Medicare until next January through March, the first quarter of the following year, and the coverage cannot start until July 1st. That's a long time. And most people who are supposed to be in Medicare but haven't gotten in on time, they have very few or no options for other coverage in the marketplace. Or if they do, they're extremely expensive and have exclusions. So do your homework up front. Now, Medicare does interact with other coverages out there. If you're a veteran or your family member is a veteran, if they're retired military, TRICARE for Life can really be great coverage and work very well and economically with Medicare. Even if you're not retired military, veterans, all veterans, have a certain amount of VA benefits. And I know the VA is stressed these days with the heavy load they're asked to take on. But I do see many people who are using their VA benefits to help them in particular with prescription drug coverage. It doesn't substitute for a Part D plan, but it can really help people cut their costs down and cover many of their medications economically. If a veteran meets other standards within the system, there are 8 levels of approval within the Veterans Administration system. The people, if they've had any type of service-related injury, so on and so forth, and are Medicare age, they would, or Medicare qualified, because you can be eligible for Medicare under 65 due to disability, they might receive even more of their care through the VA system, again, saving them a great deal of money and co-payment. You have to figure out how that's going to work. It doesn't mean it substitutes for other coverages. I've recommended to folks we've seen is you get a Medicare Advantage plan as a backup, but you use often is the case with a drug plan, and then you use the Veterans Administration as your primary source of care, because there's certain pieces they won't cover, but it's a great resource for people who are eligible, and it's really worth looking into. Federal retirees. Federal retirees are required to have Medicare Part A. Sorry, I flipped ahead there by mistake. Many people wonder if they should take the Part B because it's not required. My general advice is yes, take it, because when you don't, your costs for health care out of pocket could become quite high, if not astronomical. The advice used to be you don't need it. The problem with that is you really do now, because if many costs are not covered fully at all if you don't have that Part B, and the co-payments that people are going to be stuck with could be quite high, could be thousands of dollars a month, particularly if you have serious illness. So don't go with the old story of, I don't need Part B. Many, many times people do. But if you have A and B together and federal retiree, it can be a tremendous health package for people and can save people a lot of other costs out of pocket. And there are, as I mentioned, still employer-provided retiree coverages. And what you have to look at, there's a pitfall with holding on to them. I say it's like holding on to the mothership. People are used to that. They're comfortable. They say, well, this group always has taken care of me. The problem is some of those coverages have become very costly. And sometimes they're more costly and cover less than people could get if they went and got their own coverage. And it's really hard for people to believe, but it's true. And it's really worth shopping if people are spending, and I'm going to throw out a ballpark here, if per person beyond Medicare B premiums, if people are spending more than $300 to $400 a month on premiums individually, you really should shop. I've seen people, little old teachers paying $900 a month. They don't need to do that. And one of the pitfalls I see is that maybe you get your retiree coverage where you worked, but when you move in particular, you will be out of network for a lot of the care, and the premiums may go up, no less the out-of-pocket costs. So it's really wise when those costs are getting high that it is really worth shopping. You've saved people, honestly, thousands of dollars, $9,000, $10,000 a year in premiums. But it's stressful because they worry that, oh, I've always had this coverage. But when it's getting very expensive, it is worth shopping, always to make sure you get equal and sometimes better coverage and at a better price. So what are these penalties I've talked about? Medicare B penalty is 10% per year for every 12 months you didn't have it. And Part D is 1% per month or 12% per year for every month you didn't have it. And we do see people who didn't have coverage, they didn't understand the rules, and if you don't have a Medicare B plan for 3 years, your penalty will be 30% on top of those numbers I showed you a little while ago per year, every year, for the rest of your life. And if it's a couple, most of the time, if one is in penalty position, most of the time both are. Medicare D would be 12% per year, and if a 3-year lapse occurred, it would be 36%. That's on top of the national base premium. I've seen people not get their Medicare Part D because they think, well, I don't take medication, then I don't need it. The problem is you'll be in a penalty down the road if you get on any medication at all, and many medications are quite expensive. My recommendation when you don't take medications is get the most economical Part D plan you can find in your area. Some of them are like $15, $18 a month. It's some of the cheapest insurance you can buy, and your penalty will be much higher down the road, and you'll have to wait to get into it. So don't forego Part D because you say, oh, I don't take any, I don't need it. That isn't the way insurance works. You've got to get in at the right time, and then it'll be there for you when you need it, even if you upgrade your plan down the road in that annual enrollment period. Here's another thing that gets people a great deal anymore. I say don't let COBRA bite you. And COBRA is a type of insurance that people can get through their former employer. And when they leave their employer, most employers will provide an opportunity, and they need to allow the employee to access the employer plan when they're gone. They pay the full premium. And while that may be a good source of insurance for some people, the costs are not small, and many people do not understand that Medicare still must be primary when you are retired and Medicare eligible. It does not substitute for Medicare, and COBRA lasts 18 months, and I've seen too many people wait till the end of their 18 months and hold on to their COBRA and realize they missed their window of opportunity to get into Medicare timely, so they have to wait. The other time it comes up to bite them is if they get really sick in the middle of that 18 months. They'll find out when you get a big bill, for a big medical procedure, then only 20% of it is covered for the big premium you pay. So be very careful about that, and make sure you get Medicare Parts A and B within a very short period of time when you go into COBRA. There is a window of opportunity to do that. And then sometimes it's not even worth keeping the COBRA, and you might move right on to Medicare coverage. There are windows of opportunity to do that. For some people, it is worth keeping. If they have dependents under 65, a spouse or children, it might work to keep the COBRA, but just be aware that you don't wait till the end of COBRA, because you will have caused yourself a big problem, a lot of stress, and a lot of expense. And that definitely can be prevented. Now, Joe asked a question earlier. Okay, these premiums are based on income, but people have changes of circumstance along the way in life. And I always say, don't leave money on Medicare's table. And while it's Social Security that sets the Medicare-based premiums and the higher income amounts, they will do that when you first enter into Medicare. And they don't ask you what you made. They look at the IRS records, and they will send you a letter. It's boring looking. It's gray. It's got small print, about 4 pages long. I find people are afraid of them when they see those letters, but they're actually very clearly written. And read that letter when you get it. It'll say, here's what we think your income was 2 years ago, and based on that, this is what you're going to be your premium this year. And we'll talk about the reconsideration in a minute. They also will reread the meter every year in the fall after that. So this fall, everyone on Medicare will get a notice from Social Security saying, okay, we're looking at 2017 next year. We're going to look at your 2015 tax return, and this is what your premium is going to be. Those notices will come out usually around the end of November, and you have 60 days to respond to that notice. And it's very important. If you've had any one of these criteria, married, divorced, widowed, stop working or reduced work, and the other 3 are less common, but those first 2 are the most common, then follow the instructions exactly in the letter. They usually are, you contact Social Security first, tell them your circumstance, and they will tell you what paperwork they want. If you have left employment, maybe you are no longer working or you've reduced your work hours, they're going to want a statement to that effect from a former employer. They might want something from an accountant. If you've had a change in status, a divorce, marriage, or so on, they will ask for that kind of paperwork. You do follow those instructions, file it on a timely basis, and honestly, people are granted reasonable relief. And there is another level of appeal beyond that, but if you do it on a timely basis, it really should work out fine. Now, if you had a big payout when you retired and it was a lump sum thing, that is not one of the criteria. And so you will not be granted relief. So what I tell people is, again, work with your advisor to plan ahead, to understand if I'll meet the criteria, fine. If I won't, make sure you hold money aside so that you can pay those premiums 2 years in the future, because you will have to pay them regardless. And so that's just an important thing to know, that if, say, you need to take money, I've seen people take money out of accounts and maybe want to help an adult child. That's a wonderful thing to do. But then 2 years down the road, if it affects your income, you'll pay more in premium. Maybe you still take that withdrawal, but make sure within reason, could you have stayed under that threshold and avoided that higher premium? That could serve you well, too. So these are the reasons. File on time, and when you're not going to be eligible, plan ahead and make sure you will have the cash to pay the bill, because they will send it to you and you will have to pay it. Okay, I've mentioned a couple times how to shop smart for Medicare. Key, when you're going into Medicare as a new beneficiary, and every year in the fall, there is the annual open enrollment period, and if you're already in Medicare, you're used to getting all kinds of stuff in your mailbox and brochures and information that's somewhat helpful and somewhat very, very confusing. And the important thing is that you really can minimize your out-of-pocket costs by making sure your health care services are covered. Organize yourself ahead of time. We tell people, get yourself organized by September to have your list of your health care providers and services, so that when plans come out, you'll be able to shop and have a good list of your medications, and be very detailed. Don't just say, well, lisinopril, that's a common anti-cholesterol drug, and it's no longer called that. It's called something else. It has a generic name. So you want to use the generic names, put your little lists together, and we'll have them actually in a book that we've written, the worksheets for people to use, because you want to use the exact name of the medication, because that'll make a big difference. But when you do your shopping up front, you will get the most for your money and have the fewest exclusions and nasty surprises. So you're going to say, well, how can I do this? Because it does really vary down to the county and zip code level. So you may have a friend who's in another county or in another state or has different health care needs. It doesn't mean that their plan's going to be good for you or even available in your area. There is good local advice that a lot of it's actually free. I put it down here for you. It's very helpful. Eldercare.gov, eldercare.gov is a website, and you can also call them. And they will tell you, based on your zip code, who in your area is the regional office on aging, and they'll have different names, is available to help you. They can help you individually. They'll have lots of seminars in the fall. But the key thing is you have to check this out early. These sessions for the webinars and the seminars will fill up, and if you need individual assistance, those time slots will go quickly too. So do not wait till the end of annual enrollment. Annual enrollment is October 15th to December 7th. But call eldercare.gov and find out who in your area can help you or your family member. This is great for caregivers too. A lot of it's on the phone, so you could be in another state and they could still tell you who to call to help you help your family member in that region. Medicare.gov is interesting too. You can call them 24 hours a day, 365 days a year, believe it or not, and talk to a person. And they will take the time to take down your medication details. It's a little time consuming. You better be organized when you pick up that phone. They'll help you look for plans as well. And that could be a really good resource for people. As well as there are Medicare brokers in every area that are, this is what they do. I would look for a person that just does this type of work. And they're dedicated. They know their market and they are good at looking up medications and care providers, and they know what works for most people in their area. Another person you could ask about for pharmacy coverage is your local pharmacy provider. They too are familiar with a lot of the plans, but you still have to look for the specific medications for yourself or someone else. So some basic do's and don'ts about annual shopping. Really shop every year for Medicare coverage? No, a lot of people are not going to, but every 2 to 3 years you should, because studies show that premiums and out-of-pocket costs go up about 40% over that time, and it really does add up. And more we're seeing the premiums not increase much, but the co-payments are going up. And if you don't look at those details, you will be missing that opportunity. I already told you when that's available. And don't wait till the last minute to shop. Actually, most Americans do. The last week of open enrollment is the busiest. And I'll tell you, you can't get anyone to help you. Computer systems will bog down, and you're just going to be frustrated. So start your shopping early. And in particular, these are the key reasons why someone should shop. If your medications have changed, if your out-of-pocket costs have gotten high, if you've gotten poor customer service, and that can happen, if the premium increases have been uncomfortable, or if your plan is no longer offered. Plans get dropped all the time, and people get upset about that. They can think it's personal, that they did something wrong. Absolutely not. Plans come and go. The same company may be in your area, but just offering a different plan, or they may have decided, gee, we don't have that many people in that area, we're not going to offer a plan there. Those people actually get a special notice and have special assistance for that. So take note that plans can just totally go away, but people do need to pick a new one. And making the wrong choice, honestly, cost thousands of dollars. Okay, now here we are again giving you the old Excedrin headache. Well, what we put together here is a checklist that's really a summary of things you can do for yourself or someone you're caring for to avoid those Medicare cost sinkholes. And these are the things we've already talked about here, so I'm not going to belabor these things. I think one of the important things you can do is take a copy of your tax return to your advisor. If your if your advisor doesn't know your tax status, they can't possibly help you with this. And if you give them the information, then they can help you look at that over time and make sure that you make the most of anything you can rejigger in the portfolio, and then plan for what those costs are going to be in retirement. And it's key to set up, I think, a realistic healthcare budget. Don't kid yourself that you're not going to have to spend it. And when you have an inflation factor, that in a lot of healthcare, but a lot of routine budgets, people are using 2 or 3%. Inflation's low. Healthcare inflation always runs 2 to 3 times the consumer price index. Right now, we're saying use 6 to 7% as an inflator for that portion of your budget. You may say that's ridiculous. Well, that's what the numbers are. And again, if you don't use the proper inflator and you're looking at 5, 10, or more years, the money you have saved won't buy you what you need, and it won't be optional, and you're not going to be happy. But if you plan ahead, then you will have that money and be able to enjoy wonderful retirement and excellent health care, because that's what people want. Well, I said read the meter for Medicare when you're 64. It really is good to start thinking about it financially when you're 62. It gives you time, or even before that, to make some of these changes that will affect your income tax return. And as you see, it's always 2 years in arrears. So when you're 63, if you go into Medicare at 65, it's your tax return when you're 63 that will be the driver of those high income premiums. And many people are remaining in the workforce for multiple reasons, but make sure whether or not you need to be in Medicare or not. We've seen a lot of people make those mistakes there. Don't overlook that reconsideration. Leave money on Medicare's table. We've gone over all of that. And COBRA, can't say enough how many people we've found in trouble with the COBRA, and they're giving well-meaning but incorrect advice. You must have Medicare A and B to have primary coverage, and your COBRA could be secondary, and then see if that still is a good option for you. These useful resources, we mentioned a couple earlier. Now you have these 800 numbers. The Elder Care Locator service is wonderful, not only to help you find Medicare advice, but other elder care service advice, Medicare.gov, and Social Security. Those are all helpful information to have. If you're going to call Medicare or Social Security, if possible, avoid Mondays and Fridays. They're very busy days, and you're just going to have a longer wait and hold time. So I hope you have found this information to be helpful. We call it a hot topic. Things are changing all the time. What I'm telling you is current today. Will something new come out next week? It might. Certainly by the fall, the rates we talked about for premiums will be different, and we'll send them on to Joe, and we'll make them available to you. But a lot of things change, not just premium rates, but rules and so on. So if you'd like to stay in touch with us, please do, with our social media and our Good Care and Dr. Katy, places that you can see what's happening here. And I know that Joe asked early on for people to be emailing in questions, and he'll be providing the answers for you. So thanks so much for your attention, and I certainly wish you the best of luck with your Medicare choices and shopping, and wish you tremendous health.
Thank you, Dr. Katy. Yeah, like I said, I wanted to give Dr. Katy the most time here because there's just a lot of information that I wanted to make sure that we covered. So thanks again. We went a couple of minutes late, but I think it's well worth it. Dr. Katy, thank you very much for your time and great information, and I want to thank everyone for joining us on this webinar. Have a wonderful day, everyone.